The World Health Organization is again appealing for rich nations to hold off on plans to offer booster shots to their populations, while most of Africa is left behind in the global COVID-19 vaccination drive. More than 5.7 billion doses have been administered globally, but only 2% of them have been in Africa. Wealthy nations have promised to donate more than 1 billion vaccines, but the WHO says less than 15% of those have actually materialized. Let's discuss this then with Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter's Medical School in the UK. Doctor, a very good afternoon to you. Welcome to Newsfeed PM on Newzroom Africa. When you hear this latest appeal from the when you hear this latest appeal by the World Health Organization, it makes you wonder why anyone thinks it would change when previously the richer nations have gone ahead anyway with their vaccine plans.
Yes, I hear you. I hear you loud and clear, and I hear you with great disappointment. The World Health Organization just doesn't have the muscle to force the richer nations, the Europeans, the United States, United Kingdom, to donate and share the vaccines across the globe. It is a tragedy, and I hope Africa will not forget what was not done for them.
Put in context, Doctor, the risk not just to Africa, but the world, if we continue on this current trajectory as far as COVID-19 vaccinations.
So, with respect to Africa, unfortunately, a lot of fellow Africans will die. That is a fact. If you don't immunize, people die. The second bit is when you have runaway infections, especially runaway extensive infections in an immune-suppressed population. So we have a lot of people with HIV who are immune-suppressed, who are not taking HIV medication, and then they get COVID infection. They will have extensive infection with COVID. And in those circumstances, more so, we can get the emergence of variants. And if a variant were to emerge, which bypasses vaccines, which causes severe disease in the younger age group and so on, it will be a global backward step.
And should the COVAX facility backed by the WHO then to roll out vaccines to the poorest nations in the world, should that still be the main vehicle? Has it succeeded in its goal?
Well, it has semi-succeeded, but it hasn't got biceps, as I say. And what is required is really a step change from the richer nations to stop using boosters, but to share the vaccines. And more importantly, in addition to sharing the vaccines, the Europeans, the United Kingdom, Australia have been reluctant to forego the patent rights and intellectual rights and enable countries like South Africa, which are eminently capable, to manufacture the vaccines and to manufacture them at large scale. They are refusing to allow this to happen.
And the argument, Dr. Pankania, about the West is that they're rolling out the booster shots because they've noticed waning efficacy from the COVID-19 vaccines. Yes, it is still above the 60% mark, in some cases about 70% in fact. How much scientific evidence is there to back up the need for booster shots, especially for the elderly population?
So you ask a very important question. So talking from first principles and as a scientist, I would agree that extremely vulnerable elderly people who produce poor immunity ought to benefit with a booster dose. To, on the other hand, give boosters to everyone aged 50 and above, irrespective of their health status, is a overkill. It's like giving life jackets to people who've already got life jackets. So the evidence is poor, and yet because we are doing what we can do in the West. It is shameful, in a short word.
Dr. Bharat Pankania, good to speak to you. Speaking to us there from the UK this afternoon about the World Health Organization's appeal for equitable distribution of COVID-19 vaccines over a year into the pandemic. We want